Welcome to Voyage Clinics podcast. I'm Dr. John Sanders, your family physician and your host. And our mission with our podcast is just to love, serve, and educate the community. And so we're happy to have one of my favorite people. I say that a lot, but Lisa really is. Lisa Hall, thank you for joining me, nurse practitioner.
Yep.
Thank you for joining us on our podcast.
I'm happy to be here.
Our objective today is really to get to know you and to really kind of hear your story and your journey, both in life and in healthcare, and maybe personal health journey, and then like how you landed here at Voyage Clinics. So I think that's just a brief outline for the folks listening.
Okay, that sounds good.
So tell us about Lisa Hall.
I'm the oldest of 8 kids. I born in Phoenix from the ages of 5 to 8. I lived in Farron, Utah, which is a small mining town, which I know you grew up in, a small mining town.
I've never heard of Farron. Where's it at?
So it's about 20 minutes south of Castledale, Utah.
I know Castledale.
South of Price. But I mean, there was one subdivision and we lived in that. There was lots of forests and creeks. And so as you talk about mushroom foraging, I think I loved riding bikes through the bike trails in the forest and building forts. It was a good way to grow up.
That's really cool. How many people in that town?
Oh, goodness. I mean, there was an elementary school. There was I am probably 2,000.
Yeah,
it's
very
little.
small. Yeah. That's really coal mine town.
Yeah,
right?
my dad was a mine coal safety director there at the coal mine.
So I'm from Round Mountain, Nevada, 800 people, and a gold and silver mine in the middle of Nevada, middle of nowhere. So that's really cool. And 8 kids, that's a big family.
It was a fun experience.
Whoa.
I love taking care of my brothers and sisters and still love having a big family.
Shauna's the second oldest in 7 kids, my wife Shauna.
Yeah.
And it is true what you said. I love taking care of my siblings because that's what it becomes. She was like the second mom to a lot of those younger kids and stuff. Yeah.
I really loved it. When I was in high school, I remember taking a physiology class. I liked it. My mom was in the nursing program, or she was going to BYU to go into the nursing program. When I did my first semester at BYU, she was in her first semester of the nursing program. And when I was in my first semester of the nursing program, she was in her last semester of the nursing program at BYU. So we got to be in there at the same time. And then when I decided to go back for a nurse practitioner, 6 years later, my mom decided to go back to nurse practitioner school after me. So we were in the program together as well.
That's amazing.
So it's fun to
Did you guys get to work together?
We did work together at Dr. Crump's office at Lakeview Family Medicine for 3 years.
Oh, that's cool.
So that was fun. And then my daughter, who's 22, she's married and she's trying to go into nursing too and wants to do nurse practitioner. So
it's a legacy.
It's really fun to connect in that way.
So let me tell you a story. So when I went to medical school, my mom went back to nursing school.
Oh, yes.
And so similar journey. And when she graduated high school, she went to a year of nursing school and then never really circled back on it until much, much later in her life. Then she graduated, and while I was doing residency and all that stuff, she worked at Oahe Indian Reservation, Northern Nevada.
Okay.
Shoshone Paiute Indian Reservation. And then when we moved to Moab, where I was a rural doc for 6 years, she came out to Monticello because Moab was too big because it's like a big city. And so she lived in Monticello, and she actually we got to work together. She was a home health and hospice nurse out there, and I was the medical director. And so we would help people in the end stages of their lives, obviously, and. It was really beautiful working with her. She's like, "Hey, Dr. Sanders." I'm like, "Mom, come on." But it was super fun.
I love it.
It was really fun. That's really cool that we got to work with our moms in their lives. Yeah. That's super cool. And that your daughter's going into nursing too.
Yeah.
Just a passion for it.
Yeah. And then you say Moab. That's where I met my husband at a young single adult river rafting activity. And so we've been married for almost 30 years. Next month, it'll be 30 years.
What rafting company do you remember?
I don't. Did you work for a rafting company there?
I know all those people. So Western or Worldwide River Expeditions, the Hazlets are really good friends, but cool. That's really cool.
Wow. It would have been 31 years ago, but
there's a good
way to connect.
A lot of love on that Colorado River. That's really cool.
Yep.
Well, that's super fun. So So then, you did nursing at BYU. Is that where you did your undergrad?
Okay. And then I worked as a labor and delivery nurse at Utah Valley and Orem Community Hospital. And then I worked at the newborn ICU at Utah Valley as well. I had my first child. He's 26-year-old Ethan. He was born at 29 weeks, and so getting that NICU experience made me want to work in the NICU as well. So
that's really
that was a cool experience.
I'm gonna high five you for the labor and delivery. I love that space.
I do too.
And I love my labor and delivery nurses. Like I delivered babies for 10 years.
Yes.
I love it, and it's just super, super fun. And that's neat that we have some common ground there too. That's so fun. That's a rewarding space to be in. Mm-hmm. You guys do most of the work. We show up and catch a baby, and I really give moms the credit. They do most of the work.
Oh, they sure do.
You guys are doing second most work, and then I smile and kiss babies. And
it was amazing to be part of that. Just really monumental time in their life, to see the bond between the mom and the dad during that time, helping each other through a really hard experience. So
it's fascinating. Labor and delivery and hospice are two of the times in healthcare that are the most, I think, special is the word, or sacred. Yeah. There's something that happens at that moment as that baby is born, and you take the child and you give that to mom and dad to kind of hold, and there's magic there, and it's so special. And it seems like all of the layers of things, that distractions and facades and all these things that we kind of manage on a day-to-day basis, they're all gone, and it's just the rawest, most real moment. And I think that's one of my favorite times in healthcare, are those real, raw, beautiful, poignant, hard, difficult. In the hospice space, it's similar. It is a very difficult transition out as it is in, on both sides of that veil, and but it can be equally as beautiful, honestly.
Yeah, I know, that makes me think. When I was a nurse practitioner, I went back to BYU for nurse practitioner school, like I said, and then I worked in family practice for a year. Then I worked for an OBGYN for a year, and then I had my aunt worked for a neurologist who was in desperate need of a nurse practitioner, and so I went to work for her and learned a lot. It was an integrative neurology practice, so we had a naturopath, we had an acupuncturist there, we had a yoga studio, we had a massage therapist. It was neat to learn about, especially with neurology. These are conditions that are affecting them for long term and can be pretty disabling. And so you're looking for, medications, but also recognizing that mind-body connection, and how much we didn't understand, but how we could see how optimizing nutrition and optimizing movement and quieting the mind or working on stress helped their chronic neurological conditions to be better. And we also did a lot of addiction. It was 2007 to 2010. It was that time when a lot of the drug reps were coming through with their oxycodone and, saying, just, don't listen to the patient. Let them tell you how much pain medicine they need. Yeah. And there were a lot of people that were on super high amounts of opiates at that time. And just in a haze, really, in their life. And so she was passionate about helping find, another way. So Suboxone was what we were getting people on to transition off. And those were some of my favorite patients because, and a lot of them were using opiates off the street, and just their lives were falling down the toilet. And as they got clarity with being on something that just helped to block the cravings, and they could start to function in life and hold a job and be present with their families, that was kind of like labor and delivery, a new birth for them, like a reawakening of, okay, this is me. My brother, when I was working there, he was a teenager. He was about 18 years old, and he was getting into a lot of legal problems to support a OxyContin habit that he was buying off the street, and just got arrested. Was having a realization I got to stop. And so he got on Suboxone. And there was a movie called Happy Valley that came out. It was a documentary showing about the drug problems here in Utah County and showing people making their drug runs. And as we went to go see that together, he was talking about, I know that person, I know this person, and what a rough life it was, but how much better he did when he just decided to get off the Suboxone in a short period of time too, because he wanted to serve a mission. Went on a mission and
Cool.
to Florida. And
Florida, let's go.
Sheila,
That's
Florida.
where I trained. Yeah. So what I heard was a journey into like functional neurology and a very holistic practice. And then also, treating and helping folks in addiction and hard places in their lives.
Yeah.
That's super, super cool. It's interesting. I think in medicine, there's such a functional element to it that the current healthcare system cannot really deliver, right? Because we've gone into this really like rapid fire, fast paced model of treatment in a lot of these clinics that it makes it really hard to slow down and really think outside of like these science boxes, right? And we are scientists, right? We're like healthcare professionals, yes, but there's so much more complexity to caring for people than a medicine. Next, here's your medicine next. And it's so cool to hear that in some of your journey, you were in that environment where you were working with yoga and breathing and meditation and mindfulness and these tools that really bring health and wellness to someone's life. In neurology, there's these functional neurologic disorders, right? And they're very, very difficult. And it is biopsychosocial. There's a 1,000% whole body approach to healing this. It's not just here's a medicine or here's some therapy, but it's all of those spaces, the biopsychosocial. I think as holistic minded individuals, being able to have the time and the bandwidth to really kind of talk it through and address some of those things is really, it's one of the reasons why I started Voyage Clinics. Like today I got to see a gal who's, having some signs and symptoms and we talked it through and we ordered some tests and we ordered some things and things are shaken out to be such that there's no science to explain what symptoms she's having, right? Like as far as like a lab that's like, oh yeah, you have this thing, or an image that shows that she has this other thing. And so we just talked that through and it took some time to discuss that. And, and she's like, I'm not crazy. You're definitely not crazy. Right. This is very real. And these symptoms are very real. They're not fake. You're not faking this in any way. Yeah. But the mind does interesting things on our bodies and we can absolutely manifest things physically, very viscerally, that are emotional things, that are deeper, like harder things that we're dealing with. So we kind of ventured in that direction and talked it through. And it was just neat to see her like recognize, wow, maybe some of the trauma that I've had in the past is like physically manifesting now. And I just think that's neat to have the bandwidth. Like it took way more than 5 minutes, right? Like that's the typical visit. We were in there like an hour. And so it's just neat to have the bandwidth to do that. And it sounds like that's right up your alley. Yeah.
After I left neurology and I moved to a family practice, it was encouraged. It was to see patients every 15 minutes, which is hard, and you're doing the best you can to stay on schedule. And during that time, I think I was just trying to keep my head above water. I felt like I wasn't. If someone had big problems, a lot of it was masked with, oh, just try this medication. Oh, maybe this medication will help. And I didn't feel like I was getting to roots of things very well. And then as I studied more and became more interested in these patients that were complex and recognizing the adrenal fatigue and how that, how our stressful lives are amplifying our existing illnesses, and just searching, I did look, I did go work for a clinic that was more hormonal and functional medicine based, and I found a lot of wisdom there. But I also found that the misinformation is hard to battle. Like it's hard. Patients they're trying to find the best information they can. I know, and they come in and, can you order all of these labs? And I'm like, okay, well, it's going to be hard for me to justify with insurance to order all this panel that you want. And so it became a real uncomfortable place of, I want to help you, but I'm under, you're wanting to use your insurance for this, and they won't, there's a chance they won't cover this or that. And so, and then also wanting to follow up more. I felt like I want patients to come in and so we can talk this out a little more, but then it looks like I'm wanting their money for more visits. And it's like, I felt it was hard to be authentic and genuine. And I think it's hard for them sometimes to say, oh, do I come in? Or they'll say, I'll come in and then I'll bring in my list of 8 things because I need to use it all for my copay to get the most of I can out of this visit. And them not realizing, that's going to take me an hour and I've got 25 minutes assigned to you. And so I feel like a genuine desire to want to address all their needs, but it's hard within the confines of insurance with asking them to come back more than what they feel like they can afford, maybe.
You voiced the concerns of both your client and you on that broken system, and it's hard. It's hard on the patients, on the clients. It's hard for them to come back, and you just want to we need to spend another 30 to 60 minutes discussing this. Yeah. Can I see you next week? And they're like, I really can't afford the copay. And then the lab thing, that's also really tough. And I found myself in those exact situations in the healthcare system. And we are compassionate healthcare providers. We love our people, and and we want to connect with them, and we want to help them, and genuinely. And it becomes more and more challenging on the system when you feel restricted by the laws of an insurance game that says no to this one test and it costs them $100. They say no to 2 tests and it costs $250, right? And whereas, this is part of the reason we established Voyage Clinics, and we have super affordable, transparent pricing on labs. So gone are the symptoms of anxiety around ordering tests, because that cortisol, AM cortisol, costs $7.
Yes.
And that the ACTH costs $8. And that the testosterone is $7 and the progesterone is $8. I'm choosing all $7, $8 ones, but I just have these memorized. Yeah. And the estradiol is $7, and a CBC is $5. A thyroid is $5. And so you're looking at a very, very transparent and easy way to kind of navigate healthcare. Most of our current clients at Voyage Clinic have insurance, and they still save money, and they love knowing what things cost, and they often just choose not to order it through insurance, because if the insurance rejects just one of those labs, it costs more than the whole panel that we ordered. Right.
With my insurance, I pay cash for everything till a high deductible. So I get my $346 bill for some labs, and that I calculated would have been about $20 at your office. So it's crazy, it's
wild
price discrepancy.
What are the other pain points that you see? Your journey, you kind of bounced around a little bit. Landing at Voyage Clinics, what was that like for you as far as seeing the style there, and it's a membership model, it's a subscription that's reasonably affordable for most folks, and then they have affordable, transparent everything else, and I don't know, there's no copays, right? So they can come back and come back and come back, and you can spend another. I do need to talk to you again next week. Is that okay? Can we visit again? And there's none of that tug of war match. Well, you're just after my copay or another office visit. Exactly. It's super nice. Yeah.
I remember it was 2 years ago that we were going away for spring break, and so I babysat your clinic or covered your clinic for a week, and that's what really opened my eyes. And at that point, I thought, I really want to do this, and I was so close to leaving my practice. And then I thought, but I can't leave my patients. I thought that I would need to I thought that I'd need to give up insurance privileges completely. And so I just thought, I don't know if I can take that leap. My patients mean so much to me. After 2 years of really mulling it over, I thought if they could just see how good it can be, that the level of care that we can give at Voyage Clinics, I think they would find a way to work the finances out to come, because you are fantastic. Marilyn Sorensen is fantastic. Like, I feel like the team it's so wonderful to work at a practice where I feel like if I have to be away for vacation, they're going to get amazing providers to take care of them while I'm gone. And I have a back surgery coming up, and I've been so nervous to take time off to do that for when I worked at the other clinics, because I thought, what will they do with my patients? When I went on maternity leave in 2015, I had a baby when I was 40, a wonderful surprise, little Amber, we love her. But the clinic that I was at, the doctor essentially shamed them and said, if you're on pain meds, you need to go to a pain clinic. It made them feel like they were bad people for being on pain medication. I had 12 patients on pain meds. I asked him if he would just please keep them on for 2 months while I was on maternity leave, and he didn't. He and others, felt like they weren't respected or treated with dignity. And I just feel like this is such a nurturing clinic of recognizing the beautiful spirit in each client. So
I love it. I think you resonate so well with me. I've been recruiting you for some time now, so I'm really grateful.
I'm so happy to finally have come to my senses.
Well, I don't know that it is that. I think your journey is very common, and I don't know that I would have done it any differently had we switched places. I think there is a deep loyalty to our clients and our patients. We love them, and to have to put a boundary in place to the current broken system and say, yeah, this costs a little bit of money in a membership annually, but it is worth it because we together will re-script healthcare. We can actually rewrite the whole thing. Right now, we've allowed ourselves to be subject to a system that's largely hospital, large corporate, conglomerate run, and then insurance run and government run. And they dictate what we kind of do with our relationships with our people. And so there comes a time in our lives where we have to just say, the system is so broken. Can we step off of the system and do something totally different? When I was in Moab for 6 years, delivering babies number 2 and 3 for these mamas now, I don't know that I would have been able to do it, honestly. I have a colleague that we talk at least with some degree of frequency every few months or so. And he's a wonderful guy. He's a wonderful family doc up north. He's up in about an hour and a half north of here. Yeah. And he and I just talk every once in a while. And he wants so bad to do direct primary care, like a Voyage Clinics model. And I've given him everything I can give him as far as tips and tricks and ideas. And he just can't make the leap because he's been doing it for 11 years there, also delivering babies, also doing all that. And the relationships are deep with these families. And it is hard to have a boundary against a broken system when you're trying to care for people. And if, like you said, I think if your clients could see, yes, you're going to spend this much more money, but copays are gone. Deductibles are gone. You can now text or call, video chat whenever you want. We can get you taken care of in a way that's best for you, not best for your insurance company or best for our pocketbook, because it is just a really affordable membership. And then when you have negotiated labs, negotiated imaging, pathology, you can bring so much more to their healthcare equation very affordably and transparently and with whatever degree of frequency we decide, right? Like you and the client get to decide, you know what, I think we do need to recheck your levels in 2 weeks or 2 months. And insurance wouldn't pay for that, but guess what? It's $5 here. So let's just look at it. And so it just really is nice to create a different movement. And it is a hard leap. So I don't disparage you for taking some time to come around, but I do appreciate that. And I think if there's something you could say to your current clients, what would you tell them, like with regard to this?
what I've been really impressed, just as I've been studying this week and making this transition, I've listened to almost all of your podcasts,
Whoa.
and it's such a good resource for us to share with our patients as they hear you have a conversation with a respected, compassionate specialist, endocrinologists, neurosurgeons, psychiatrists, to get evidence-based, very high quality scientific information that is delivered by a person who has a big heart and loves people. I feel like that's been really fun to see those podcasts. You have a lot of information in your charting system. You call them macros, just to for us to text to patients. So what I've been looking for many years is how to be effective, how to help patients actually see change in their lives and not just be in a rut moving along. And when I can give you, email you and text you information that is easy for you to reference back to. You also have health coaching available. And I've looked through those modules. I thought, wow, just having access to a person who's like giving you good information and helping you along each week. I am hopeful that patients that I've been working with for years that might feel in a rut will come here and like see a turnaround in their life and prevent needing to see specialists. Hopefully, there are some things that are inevitable, but if we can optimize their health as best as we can in primary care, which is what I feel like our job is. I don't want to be a referral list. I want to be someone who is taking care of you to get you to your best place, so that we don't need specialists as much.
Well, I'm excited for your secret sauce too, because I've been pouring sauce into this equation for 7, 8, almost 8 years now, and just polishing, just working the equation and trying to get it better and better. And what can we do to better deliver excellent care to our people, to create more education? Launching the podcast this last year was super fun. Sean and I working really hard on the health coach program. We developed a sleep coach program, working out protocols that are evidence-based around ketamine therapies for our clients as well. That's affordable. I think it's been really fun to just sculpt, and I'm excited for your sculpturing as well, as you enter in and add your energies and your innovations and stuff. And I think we can it's such a neat team that we've developed, and it's going to be really fun.
It's going to be good. Yeah.
Let's pivot to your personal journey if you want. And maybe you can talk to us a little bit about what you've kind of learned in that space and how that has been for you.
Well, I mean, I think, you kind of feel a calling toward practicing in medicine, but and nursing and just being a caregiver, and I think part of that calling is to have your own personal health issues or difficulties or whatever to educate you, so that you can be more empathetic as a provider. And so, like I said, I had my first son premature. I had something called HELP syndrome, or pregnancy-induced hypertension, that don't know why it happened, but blood pressure went really high, and seizure, and liver was failing, and they just had to get him out. And so, but going through that NICU experience, him being in there for 10 weeks was helpful to gain knowledge for while I was working as a labor and delivery nurse and a NICU nurse, to be more compassionate and empathetic to my patients. And then I had a blood clot that was in my left leg from my iliac vein, which is a big vessel that comes down from your abdomen and branches down into your legs. It got completely occluded.
Was that postpartum related or not related?
It just was a gradual narrowing of that vessel and clotted, and then 11 years later it closed down again. And so this pain, it was hard to describe, but I got to feel what vascular pain and poor circulation problems. It caused a lot of varicose veins through my abdomen. And so it alerted me to not forget the vascular system when I'm doing exams on patients.
Mm-hmm.
And then my daughter, she had a lot of GI problems. And so we were, looking at allergies or, gallbladder, and she was diagnosed with celiac disease. And I remember going to Zupa's with her right after she got diagnosed. And I'm like, oh, good. Can I have your bread? And so I'm eating her bread. I'm like not being very empathetic to her. And just saying, well, here's your cupboard at home. And, I wasn't. And then I got diagnosed with celiac a week later. And I was
totally jinxed yourself.
Oh, yeah. And then it's like, oh, my goodness, now we're fully cleaning out the... When I had it, I was... Yeah, that was a little ridiculous. I feel really bad for my daughter, Summer, as I wasn't so empathetic to her. But when I got it, then...
Now you get it.
The whole family better be gluten-free now. So... but her experience, she had a lot of tummy problems. And my symptoms were different. I don't immediately get sick when I eat gluten. I do now, but before I kind of acclimated to it, I suppose. But anyway, just that I was in a haze for about 3 years of just like, I don't know what's wrong with me. I had vague symptoms. And so it helped to connect me to my other patients who were in that space of, I'm not diagnosed. I just feel crummy, but what can we do to try to work you up and try to find some answers? So I did a lot of studying during that time. And I think that, and then I have something called intracranial hypertension. I just hear a heartbeat whooshing sound in my ear all the time and have a narrowed blood vessel in my brain. And maybe the celiac, maybe that's what the root of it was. It just narrows my blood vessels and causes different problems. I don't know, but anyway, it gave me a certain kind of a headache that was different than migraines. And as I was seeing patients, I could say, well, is your headache kind of like this? And so I've been able to tease out some of my migraine patients and actually get them on more appropriate therapy for intracranial hypertension. And
this is such a great, what a cool journey. And what thank you for sharing. What you've described is what we consider in medicine as some zebras, which are not common things that happen to people. And so sometimes docs, nurse practitioners, providers, folks, they get used to treating horses a lot. We see a lot of horses. A horse walks through the office 20, many, many times a week. And every once in a while, a zebra walks through. And in our sick care system, right, our less time with people system, it's really hard to really dive into zebras, to really get them really, truly figured out. And it sounds like you kind of went through a self-discovery mode where you had to dig deep, and you had probably the benefit of being a provider yourself to really be able to dig through and ping around with other docs and like kick it around and ask some questions and get past some things. But the average patient doesn't have that. And I think that's so neat. I think one is developing the empathy to chronic real pain and vascular or otherwise, like low back pain, vascular pain, undiagnosed pain, right? Where the docs are thinking no, this doesn't make sense. I know that makes sense. So therefore you're lying, and therefore we're not going to treat you. And that you've been on that side of that fence, and boy, does that create some empathy to people like going through it. Celiac, like, oh, you got some vague abdominal pain. Welcome to the club, everybody. And even like your gestalt to your daughter is not uncommon in healthcare.
Summer, I'm sorry.
You heard it, Summer. She's sorry. But it's just so. I think we get stuck in the system in not having the bandwidth or the empathy to really get past the surface, because I have 5 minutes. It could be something. It could be 5 other things. That's true. But the thing that it probably is this thing. And you're going to have to come back, and we're going to have to keep talking if it's not that, by the way.
Yes.
And then 8, 10 visits later, they might clench a diagnosis, right? Because that's 60 to 80 minutes. Yeah. And our one office visit is 60 to 30 to 60 minutes,
You can
and
do a lot in that.
so we can do 6 other and get past the surface and keep asking questions and tell me more. Like something's not matching up. Like I had a gal with a headache the other day and she was like, I got migraines. I said, really? Well, tell me more. And so she started telling me a story and I'm like, well, maybe this. And okay, that doesn't match up with exactly. And that's not even atypical migraine. So we kept asking questions and she kept talking. And I said, well, gosh, we spent 60 minutes together. And I think this is probably what's going on. Let's try this medicine. And I'll tell you what, I want to see you next week and see if it's working. So I see her the next week, and then she tells me a little bit more of her story. She's like, Doc, this isn't helping at all. I'm like, okay, well, tell me more. Yeah. So she tells me 3 more things, and I'm like, oh, it's this. It's totally something different. And she's like, oh, well, that makes sense. And so we treated that. And so here we are, probably a week or 2 later, she'll come back and tell me I'm a dummy again, and I missed it again. But that's just a neat process to be able to have the bandwidth to get past the surface level care that's out there. And
follow it more frequently. I like that.
Mm-hmm.
And I feel like there's just a piece that I have felt as I've made the decision to move to Voyage, and feeling like a lot of like you hire awesome medical assistants that take a lot of things that I had been doing off my plate so that I can just spend time focusing on studying and becoming really familiar with any red flags or being as good of a diagnostician as I can, recognizing when I need to send to a specialist, of course, but I feel like a piece of for me to be able to be the best I can be by coming here.
I felt the exact same when I started Voyage. We moved here from Moab, 4 kids in like elementary through high school, and my wife is in law school, and I quit my job and I started Voyage Clinics, and I felt a peace, and Shauna felt the same. And I was like, there was some turmoil as well. There was some fear. There's all those things, but I just knew it was the right thing for caring for people, and it's been such a lovely journey. It was hard for a while. Yes, it's hard to jump off these cliffs and free fall for a while, and then gain traction and succeed. But man, it's been so fun to really change healthcare for our clients and really give them a taste of what it could be if we continue to invest in movements like this and move the needle a little bit in caring for people. It's really fun.
Yeah, for sure.
Well, I love it. I often tell my colleagues, I say, before you prescribe that medicine, you should try it. And it goes along the lines of what you were saying, where, before you judge someone with back pain, right, you should try it.
Yeah.
And I'm going to have knee surgery, and I'm like really happy that you and Marilyn have joined our team, because now I know they'll be in great hands, and you guys are both excellent. And I just think that's super great. I also wanted to mention a couple of tools. Well, you mentioned previously in functional medicine and like hormone clinics, sometimes there's some graying of the lines of evidence, right? And for good or for worse, like I think there's things out there that haven't been researched as well as they could be that actually still work really well, and that's great. Yeah. As healthcare providers, I think we're under kind of like moral obligation to try to be as ethical as possible with regard to our recommendations to people and recommending, science and at least good data or good information to them. Yes. And I think the world, if there's any positive silver lining to artificial intelligence, it is this. And that is because artificial intelligence can go out and pull the data and give me a distilled version of that data as long as its sources are good. Now, ChatGPT sources are often not awesome because they're just pulling the internet and whoever's putting free stuff up there. Well, data is sometimes paywalled. And so the New England Journal of Medicine, JAMA, you've got these big research facilities, these big med schools, these big things, and they're paywalled. So what that means is ChatGPT doesn't have access to that data. unless somebody else, recites the data and interprets it and tells it this is the data. Yeah. So recently, I should know these sources, but there's a open evidence AI. Yeah. And I believe it's, I don't want to misquote, so I'm not going to quote it, but there's some medical schools and other people that are investing in open evidence AI, which they're paying for the paywalls. So now it pulls from all the data, all the research, all the journals, and we can look things up a lot more quickly.
I have loved using that.
It's amazing.
Yes.
A few years ago, before AI, right? Just a few years ago, I hired these pre-med kids. They're excellent. They're on their way to med school. They're very, very intelligent, and they want to. They're data driven. They're excellent. Yeah. So I would often give one of them a topic to bird dog for me, because I'm like, well, pull the data, go to PubMed and like pull all the research articles, and let's cull through some of that. And it would take them a week or more for one point of data that I wanted to distill out and say, what's the new evidence on this treatment protocol or this thing? And so open evidence AI has been a game changer for that practice. Now, if you're concerned that estradiol causes breast cancer, you can ask, and you can actually see the data on hormone replacement therapy and breast cancer, whether it's progesterone, estrogen, bioidentical, not bioidentical. You can see what those data points are, and then it just arms you with really good knowledge that you can share with people and say, here's what the evidence shows. And, we don't have to follow evidence all the time in medicine, but this is what the evidence shows, and that's pretty neat. Yeah. There's another one that's called examine.com.
Oh, I haven't heard of that.
We love it. We have a membership in our office, paid for the whole lifetime membership of examine.com. Examine.com does nutraceuticals, so all the supplements. And it has collected and continues to collaborate and collect all the data behind all nutraceuticals. So does vitamin C help with the common cold, right? My mom, everybody's moms have been doing vitamin C forever. And, this is disappointing, and probably the internet will hate me for this, but there is no data that vitamin C helps with the common cold. Oh. And so yeah, me too. I was like, what? No way. But guess what does work? Echinacea. Guess what else does work? Elderberry extract. Not for COVID, but for other things. That's great. Yeah. And the way that they work is neat. And so it's just wonderful to be able to use these AI-driven tools to just be my med students, right? Go out there, pull the data, give me what's the newest research on this space. And because of the rapid fire pace of the current healthcare system, there has been a paucity of an ability to actually go look at the data. And so this is part of the dogma of healthcare, in that docs are often, and nurse practitioners, whomever, healthcare providers are not willing to look outside of the current evidence. And the current evidence of what you learned like 10 years ago or 15 years ago back in med school, it is not even outdated. Close to what's, yeah. And do you have the bandwidth with your 35 or 6 patients an hour, or whatever you're doing? You got to go home and chart for an additional 2 hours. There's no way you have bandwidth to just look at the data. We go to these continuing medical education conferences. Half of the room is still charting. Every time I go, I'm never charting because I've changed it, right? I'm just sitting there listening and learning and loving it. Yeah. And all my colleagues are like slogging through notes. And it is a bum deal because it's just what it is. But silver lining, AI helps us be more efficient. Yes. Doesn't help us step off of the total brokenness of the current healthcare system, but I think it's kind of neat to have these tools.
It is. It's incredible. There's that Heidi app that it just listens and writes up a summary so that we can just be more eye to eye with our patients as we're talking. Yep. That's huge. Huge.
Yeah. Anyway, it's so fun. It's so fun to innovate and to just move things along and be better. Lisa, this has been really fun. Is there anything else that we need to talk about today? I've really enjoyed getting to know you. Your husband and I have been pickleball bros for a long time.
Oh yeah, that's where I first met you.
Yeah, he's a good lefty. Yeah, I mean, hobbies and interests. You enjoy outdoors, and what do you like to do?
So I took tennis lessons with my kids. I guess I just like doing what my kids like doing. Even when my son got braces, I got braces with him, and then totally thought, what am I doing? That's the biggest mistake. I left him on for a year and I couldn't do it anymore. But I did like taking tennis lessons with those 2 older kids. That was great. And then my daughter, she wanted to take Irish dance when she was 6. And so I signed up for the adult class of Irish dance and really loved it. So I had to quit. My husband's a YSA bishop right now in our church. And so we have activities on the night that is the adult Irish dance. But when he's released, I'm going to go back. They did make me perform in a dance recital. I didn't know that was part of the bargain. That was a little, what am I doing up here? But it was good for me to, go out of my comfort zone. And
that's so funny. That's awesome.
But I like dance stuff. I liked Zumba when that came out. And,
nice.
But I'm not good. I look like an uncoordinated lady in the back trying to keep up, but it's fun.
We have so many things in common. When I was at UNLV for undergrad, I took all the science for pre-med, and my undergrad was in sports medicine. But just to balance the equation, I'd always take a dance class every semester.
Yes. Did you take clogging and tap dance?
I took a whole bunch of dance classes, and it was really satisfying. And my favorite, I'm Hispanic, and I like the Latin dance scene, and Vegas has some good clubs and stuff.
Fun.
That was a whole nother world ago. But yeah, dance is so fun. It's so good for you. It's so healthy. Yeah, that's so cool.
No, I have patients that just dance they get great workouts doing the, what is it? It's not a Wii. I don't even know. What is that gaming system?
Oh, the Switch? Are they doing Switch? Yeah.
Yes.
That's cool. Well, fun. Lisa, so fun to get to know you. And I hope this was really great for our people and the community, just to get to know who you are and your journey. And you can totally feel your values are just so awesome. And they're aligned with me. They're aligned with Voyage Clinics. And I really hope that all your current clients can see it and come over. I think it'll be really, I think it'll be really cool for you too, because it is fun to keep those relationships moving.
Yeah, for sure.
Cool. Anything in closing? Anything else? This was so fun.
I don't know. This was my very first podcast.
You did good. You did so good.
But yeah, it was.
Let's do some more.
Fun.
Let's do some on whatever topics you're passionate about.
Okay.
I really enjoy that. And I'd love to hear more of your expertise, maybe in the functional neurology spaces, or even like some of the functional medicine spaces. And I think there's some really good knowledge to put out there for our people.
Oh, well, thank you so much. I'm thrilled to join the team.
Well, we hope you enjoyed our podcast today. Thank you. Like and subscribe. And yeah, we'll see you next time.